Hello, my name is Alex Tomesch. I am a third-year emergency medicine resident at the University of Iowa. I'm going to be talking to you today about my abstract entitled Epidemiology of Fractures in United States Emergency Departments. I would like to acknowledge my co-authors who have helped me a lot throughout this process. I'd also like to thank the University of Iowa Emergency Department who helped purchase the database that we used for this study. Myself and my co-authors do not have any disclosures. Background information. So we all know orthopedic injuries are common in the emergency department, something that we see on a daily basis. However, despite this, there's actually minimal information in the literature about type and frequency of orthopedic injuries that come to the emergency department. There have been a couple of previous studies done looking at this, but they've been done at the extremes of ages. So there was a pediatric paper that was published that showed that forearm fractures were the most common injury for pediatric patients. And there was a study done in the geriatric patient population that showed lower trunk fractures, which was a combination of pelvis, hip, and lumbar spine injuries, were the most common in the geriatric patients. But there have not been any studies that show the fracture patterns seen in the general population. Objectives of this study were to identify common ED injury-related fractures and characterize the patient population that these are occurring in, and then to further assess the hospital settings that people were coming in to see a provider for these injuries and the cost that was associated with that, as well as the disposition of these patients, whether they're being admitted or discharged home. Our method, so this is a cross-sectional study. We use the 2016 nationwide emergency department sample database. This is a database that has about 1,000 emergency departments nationwide, and it accounts for about a 20% sample of all the ED visits yearly in the nation. And they had about 145 million visits yearly to draw from. We took the ICD-10 fracture codes and boiled those down to the acute visit codes, getting rid of primarily the sequelae and subsequent encounter visits, and then used those codes to query the NEDS database. Using that, we found the most prevalent fractures using weighted frequencies, and then we were able to pull the demographics of the patients for each of those injuries. And then the NEDS database also allows us to see what the cost of these fracture visits was, and also to see whether these patients were getting admitted or discharged. Results from our study, there were a total of 5.88 million fractures in the database for 2016. And then you can see here the most common fracture was radius fracture, followed by rib, femur, finger, and fibula injuries. Then looking at whether patients got admitted or discharged, 22.8% of subjects were admitted to the hospital actually, and 4.1% of patients had to be transferred for higher level of care. The average ED charge for a fracture injury was about $2,400. So in conclusion, this study helps to better define what type of fractures we're most frequently seeing in the emergency department. I think this is important because it allows for us to construct protocols for the fractures that are more commonly seen. And this is, I think, even more important in academic centers where you have both orthopedic residents and emergency department residents trying to learn the management in the acute setting for these injuries. And if we can build protocols for these types of injuries, then I think it will help facilitate better education in residency for emergency medicine residents about these fracture patterns and care for them acutely in the emergency department. These are my references. And if you have any questions, please feel free to reach out to me at my email here. Thank you.